understaffed and overworked. Medical workers in Somaliland struggle to keep up with the number of patients needing help in the midst of a severe drought.
Tuberculosis kills thousands of people around the world every year, with many of the deaths occurring in Africa. Although new treatments are being rolled out, drug-resistant strains of TB are making the fight more difficult.
And it's called Little Mogadishu, a neighborhood in Minneapolis where an American sport is giving young ethnic Somalis a chance to build their confidence along with their game skills. Africa 54 starts right now.
Hello everyone, I'm Chamberlain Uso at Channels Television here in Lagos. Welcome to our show as we go around the continent to bring you a variety of stories. And I'm joined as always by my colleague and co-host in Washington, Vincent Macquarie.
Well, thanks a lot, Chamberlain. I'm coming to you from our studios at Voice of America headquarters. We begin our program this week with a look at ways to improve pregnancy outcomes. Chamberlain has that story for us first.
Well, yes, the global maternal mortality rate is declining, but it's still far from the Sustainable Development Goal of 70 per 100,000 live births by 2030. In Adamawa State, northeast Nigeria, the Ministry of Health and other groups are working to help health workers save lives. Here's the report.
Despite efforts to reduce the maternal mortality ratio in developing countries, a large number of women remain at risk, especially in rural areas. To tackle this problem in parts of Nigeria's northeast, the Ministry of Health in Adamawa State, in conjunction with the World Health Organization and the Save 1 Million Lives program, has organized a 3-week training on modified life-saving skills for officials of the Ministry of Health, midwives, nurses and other health workers. The essence of the training is to scale up efforts towards saving lives in the northeast region. The permanent secretary of the ministry believes, beyond imparting knowledge and skills to the health workers, proper orientation of pregnant women and their families on the importance of antenatal care will go a long way towards achieving the desired result.
There is the component of nutrition, that is the component of service delivery, and then there is the component of attitude. People don't attend antenatal services as at when due. When women are pregnant, they wait until complications develop before they are rushed to private hospitals or facilities. So we really want to also bring it to the attention of both the parents, the woman and the man, that attending ANC is very, very important.
According to the representative of the World Health Organization, the essence of such trainings is to ensure that the health workers are abreast of new developments in the field of healthcare.
The Save 1 Million Lives project is a high-impact intervention to better the indicators for reproductive health, maternal health, child health and nutrition within a period of time. So this training is to bring the service providers together as the frontline service providers, to reorient them, for them to acquire skills to be able to deliver on these projects.
While health experts agree that maternal mortality ratio is still unacceptably high in rural areas, they advocate regular training and other programs for health workers and other members of the community to reduce the number to the barest minimum.
You're watching Africa 54. I'm Chamberlain Uso. Protests and attacks against African immigrants have occurred in recent months in South Africa, with a wave of street clashes and looting of shops owned by foreign nationals. Well, joining us to talk about these attacks is Lebanon Chaka, chairperson of the Thabo Mbeki African Leadership Institute Alumni Forum. Welcome to the program. Let's start by asking you, can there ever be any justification for this growing xenophobic attacks?
Hi everyone, thank you for having me on the show. I think that when we use the word justification and then we talk about xenophobia in one line, we can never put the two together. So I think what I'd like to reflect on is some of our government leaders that have been vocal against this. And some of the attacks happened in the Gauteng region of South Africa, and our premier was he didn't mince his words, and he said there's no room for xenophobia in Africa, whether you come from the East, West, North Africa. You can choose whichever part of the continent that will offer you the best opportunities. And with that said, I stand by those words that there is no room. And if there's no room, we cannot even begin to say there is a justification.
Now, I understand that some South Africans say that they are aggrieved over foreign nationals committing crimes. But the worry is the use of violence to express these attacks. How have the authorities address this matter?
So, when we talk about violence, right, what's happened, I know the media or some of the reports that have been coming out have been highlighting the violence, but, and I'm not saying that it's justified in any way, but we need to understand things within context. We've recently seen, and not even recently, we've seen South Africans demonstrate in various ways. We've had situations where a community didn't want to be put into a certain municipality, and as a result, they were burning schools. We've had South Africans, in a way, protest in ways that manifest violence, And when one sits and analyzes the history of our country and how even the way that the apartheid government, for instance, was overthrown, you do see incidences of violence. So I think what is, and this is my interpretation of the situation, we found ourselves in a way that when we do need to discuss issues, we don't have those spaces where we actually can have those conversations and say what is actually going on, what is happening in the ground, instead of resorting to violence in different ways. And it manifests when our citizens are protesting about anything from service delivery to water cuts, or you will see those incidences of violence. So it's a conversation that we need to have as a country to say, what are the spaces that we can have to have conversations and not resort to violence, because it manifests itself in different ways whenever there is a problem in the country.
What can you tell us about several reports actually pointing out that some politicians appear to be fueling these attacks? What's being done about that?
Really, our officials are getting involved and they are condemning this. There's politicians, like I said, like the Gauteng Premier, David Makura, who joined an anti-xenophobia march this past Tuesday, to say that this is unacceptable and it will not be tolerated. So I think instead of focusing on the politicians that may have their own personal views, I think it should also be noted that there are politicians that are coming out and saying this is wrong. And I always emphasize that it's in any country, it is not about, we should not, as citizens, ever think that we should hand over our power to government. It is to us as citizens to say, this is not right. What are we doing in our spaces as South Africans, raising children in a country that is very diverse, that really owes its freedom to the rest of the continent, to say, you're teaching your children Pan-African values that say, we are Africans, and how those conversations also happen at that micro level. Before we always just go for the macro level and say, what is the government doing? It also falls back to us as citizens to take the responsibility.
Olusegun Chaka with the Thabo Mbeki African Leadership Institute. Thank you for talking to us today on the program.
Thank you so much for having me.
Well, we want to know what you think about Africa 54 and the stories we covered during the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com. Well, now coming up, fighting tuberculosis in South Africa and elsewhere. Treatments are improving, but resistant bacteria is making the battle against TB even harder. We'll have more after the break.